Thank you, Chairman Pitts. Medicare and Medicaid are important programs that are unfortunately unsustainable in their current form. Medicare, per the actuaries who run the program, is going bankrupt in 10 years, hastened by $500 billion extracted from it by Obamacare. Medicaid is bankrupting states, and this is before the Obamacare mandates that usurp state rights. Now, as a doctor who still teaches and treats the uninsured in a public hospital, though, my primary concern is patient welfare. And fortunately, there's an opportunity for improvement. As we know, dual eligibles oftentimes have poor outcomes. Now, Republicans have proposed freeing states from the rigid Medicaid rules, which make it difficult to coordinate benefits between Medicaid and Medicare. We've also put forward a plan to save Medicare from bankruptcy, to preserve Medicare as it has been known for those who are on it, and to preserve it for those who will be on it. Now, saving Medicare from bankruptcy is important for all Americans, all senior citizens, but particularly for dual eligibles. Now, unfortunately, under the current situation, Medicare provides incentives to treat patients in one way, and it provides Medicaid incentives to treat patients in another way. And these dueling incentives oftentimes lead to poor patient outcomes. This is the problem of large bureaucracies trying to dictate what happens to a patient in a patient's exam room. We can do better. So despite the fact that Medicare and Medicaid spend disproportionate amounts upon dual eligible patients, again, our outcomes are poor. And this is actually the most important issues. Now, we should note that we shouldn't take the policy of do nothing for short-term political gain and kick this issue or Medicare's fiscal solvencies as an issue down the road. We've got to address it now. I'm very interested in the perspectives presented here today. I've had the pleasure to speak with Ms. Bella. She's knowledgeable. I just look forward to it. Similarly, the perspective of the PACE providers and the states. I will say of the Office of Dual Eligibles, I kind of like that. It's the one provision of Obamacare I applaud. As we say in the South, even a blind hog finds an acorn every now and then. I yield back.